With me now is Dr. Dina Kulik, pediatrician and founder of Kid Crew Medical. Doctor, good morning to you. Nice to see you. I want to start by getting your reaction to this news that the Red Cross is coming in to help CHEO.
Good morning. I mean, it certainly is an SOS, if you will. We know that many hospitals, many clinics have been a bit underwater in recent months due to really the humongous surge in viral illness that we're seeing, unprecedented numbers of sick children from COVID, from influenza, from RSV. And CHEO has been very outspoken about the challenges they're facing with this significant surge of patients and having to redeploy many of their staff, physicians, respiratory therapists, phlebotomists, nurses, to the emergency department to help offset that surge. Now they're saying, we just can't keep doing this. We need added help. It should really be sending a very clear message to the province and to the country that there's a significant burden here from viral illness in children.
Yeah, because we think of the Red Cross as an organization that responds to emergencies, and clearly we are in an emergency right now. I do want to ask you, how serious are most of the illnesses that children have right now? How serious are they?
Luckily, most kids have mild illness. You know, kids are having RSV and flu and COVID, as I mentioned, and many kids are having runny nose or cough, sneezing, sore throats, and fevers. Most kids can definitely be managed at home with rest and fluids and fever reducing medications, which thankfully are coming back on the market again. We're seeing that in many pharmacies. However, some kids do get very sick, particularly young babies, vulnerable babies with RSV, and that's leading to these significant surges, not just in hospital visits, but also admissions and need for the ICU.
What are you seeing at your practice, doctor?
Many sick patients. Yeah, we've been having really high numbers of sick patients throughout even the summer, but for sure picking up into the fall and now winter. Usually there's a big lull in the summer where kids are not that sick. They're outdoors. They don't usually have the same kind of viruses we see in the fall and winter. But no doubt it's been high this summer, but also now much higher than typical for the beginning of December.
Yeah, it's really exploded. So what needs to change at the provincial and federal level, doctor?
I'm not sure I could speak to that, not a politician, but I can say that keeping kids home when they're sick, staying home from work if you're sick, very helpful to prevent the spread from me to you and you to me if you're sick. Wearing masks when possible. I think that while it's not a mask mandate right now, I do encourage kids and adults to wear masks when that's possible for them. If they're older than two, masks have very minimal risk, if any risk at all. Sure, they may not be the most comfortable, but they do a very good job of preventing viral spread and keeping your hands clean, staying healthy, getting enough sleep. But please stay home if you're sick, because that's how viruses spread, from a person with a virus to a person that doesn't yet have a virus.
Dr. Dina Kulik, thank you so much.